Hey, it's Dr. Fred here, and we are going through the Back to Health book, and we're going to talk about one of the most controversial, if not untold, stories that chiropractors have been telling for decades to parents if you're teaching in your workshop. And that is one tragic thing, is sudden infant death, but how the birth process can twist these upper cervicals out of place, cause nerve stress, not only lead to things like sudden infant death, which is very traumatic, obviously, but can lead to learning disabilities and motor problems and speech problems and asymmetry in development and a lot of neurological problems. So let's check this out. So we're going to go through, what's the name of this chapter? Structural and biomechanical distortions of the curve. And this is in the Back to Health book. And for the general public, best kept secret to heal your back pain, go get it on Amazon. So check this out. Spinal structures can distort abnormally, and I'm paraphrasing here, as a result of positions in the womb. So your kid, that infant, is stuck in this cramped place. You know, they're moving around, they get stuck, they got a big fat head, little skinny spine, and that's a lot of stress on the upper cervical. So as they're born, the normal birth process, now check this out, it says right here, during delivery, a majority, it didn't say minority, it said majority of newborns suffer from microtrauma, that small trauma to the brainstem, that's part of the brain that exits the skull, starts to go down your spine, brainstem tissues to the periventricular areas, that's up high in your upper cervicals. Consequently, the motor development cannot develop normally. These are kids that are uncoordinated. These are kids that may stutter. These are kids that have speech impediments. These are kids that have asymmetries, problems with balance. These are kids that, and even adults, when you're out of alignment up here causing nerve stress, that you have motion sickness. I mean, we'll go, these are kids that get dizzy easy. I mean, there's tons of problems. So check that out. Can cause abnormal motor development, right? Later on, at the age of 5 or 6, now newborns that have nerve stress from the birth process, later on at the age 5 or 6, they suffer from headaches, postural problems. That means their spine won't develop normally. Scoliosis, abnormal spinal patterns, abnormal hip development, legs that grow at different lengths, distort their spine. And now they become, if you don't fix that when they're young, they become permanently impaired. Diffuse symptoms like sleep disorders, unable to concentrate, ADD. I mean, do we need to go on? These are things that happen from neurological problems during the birth process because the kid's got a big old head and a little skinny spine, and it can twist, especially the way doctors pull them out, can twist and cause nerve stress. And I'm going to cite this study right here. So check this out. This type of trauma is also known as sudden infant death syndrome. So check this out. So there was a study of 695 infants. That's a lot. That's a good enough study. Showed that high cervicals, that means nerve problems in the upper neck, mechanical irritation could serve as a trigger in sudden infant deaths. Now, why is that? And then we find out that there's the nerves for heart right there can cause heart rate problems. So all of a sudden their heart stops because of nerve stress up here. Breathing problems. All of a sudden they stop breathing. And when they say don't lay them on their stomach, why? Well, there's a few reasons, but one, they lay on their stomach, their head is turned, they already have trauma there. You're adding massive stress to the nervous system that causes motor development, is nerve centers for the heart, cardiac centers up there. Major problems, man, in breathing and respiratory centers. So check this out. Right now, and this is what it says in the book, so should your patients read this. Right now, your children's spinal development may be determining their health for the rest of their lives. Yeah, that's right, because it also affects the immune system. We're going to get into that. Be sure your child is developing a healthy spinal structure and nervous system from the beginning of life to ensure better health, strength, and a better life. And that's better health for life. So check this out. When you look back, now you can look back because when I was born with an umbilical cord wrapped around my neck twice. I was actually being strangled with every uterine contraction. I almost died. It was an emergency C-section. They had to resuscitate me when I was born. And I had a weakened immune system. I had colds, flus, immune weakness, all these problems, sinus problems, all these immune problems when I was young. So when you look back, now, if you're an adult, you were these kids, if you came out of the womb, whether by C-section, forceps, vacuum extraction, those are even worse. When you look back, you all see how health problems followed certain traumas. Now, that's just traumas to your spine, sports injuries when you're a kid. For instance, there's often a decline in energy levels, an alteration in immune system function. Is that important? Because your child's immune system is developing. So when they have nerve stress in their neck and their spine, their immune system doesn't develop right. That's why kids get allergies, they get asthma, they get all these other recurrent colds and flus, immune system problems. And you take them to the doctor, and what does a pediatrician do? Give them antibiotics, give them inhalers, give them all this. But guess what they have? They don't have energy in their nervous system. Your immune system relies on energy. You don't have a health problem, you have a health condition that resulted from an energy problem. What can an MD do about an energy problem? What's in the middle of this right here? They deal with chemistry because they learn from pharmaceutical companies, while health problems, the foundation of health problems are energy problems from your nervous system, from trauma to your spine that traumatizes your nervous system. Hey, this is healthcare that your MD and healthcare provider isn't telling you, and unfortunately some chiropractors don't even tell you when they're only concerned about back pain rather than health. So, for instance, that's what it says. There's a decline, alteration in your immune system function, sometimes followed by bouts of allergies, colds, flus. And you see that with upper cervical and upper back trauma. Left uncorrected. That's probably you if you're in the general public. Many times these conditions progress into stomach, digestive. They can also progress into autoimmune. I mean, you can go on and asthma and on and on and on, because what it'll do is go from colds, flus, allergies, then it'll affect the lungs. Certainly it affects the heart. Then it'll affect digestive. That'll start breaking down. Then these are adults. All of a sudden you have IBS, irritable bowel syndrome. Well, what a great name. Thanks, Doc. Gee, I couldn't figure that out for myself, that my bowel's a little bit irritated. Thanks for the name. What are you going to do about it? Oh, we have drugs. Well, how about you look at your nervous system, ulcerative colitis, all these diseases that happen because you have an energy problem. It's not a health problem that needs to be solved with drugs. Drugs don't solve energy problems, right? This is health care. Thank you very much. So now we go to, check this out. Hey, is this a cool book or what? So then we talk about, okay, let's go to the next page. Distorted posture equals a distorted spine. So people go, God, I don't have great posture. What's that mean? You have an injured spine, which means you have an injured nervous system, which means you probably have health problems. Distorted spine negatively affects the vital life energy to the organs. Is that pretty important? What do you think? In other words, as the spine twists and bends and turns in its structure, the spinal cord that runs down the middle of your spine, that carries energy to all the organs of your body, will also twist, bend, and turn. Isn't that amazing? So as a person's health begins to break down because stress on the spinal cord shuts down the energy of the organs. There you go. This is what your healthcare providers aren't telling you, that the health problems you may have are actually energy problems because you have problems in your spine causing stress to the spinal cord and nerves that are blocking the energy of the vital organs till they break down. And then you go to the MD, and what do? You get a name, irritable bowel syndrome. Well, guess what? Gee, I have diarrhea. I didn't know irritable bowel. Like, Diagnoses just name the symptom. Well, I don't need a fucking name, pardon my language. I would like to be healed. Thank you very much. Okay, so, and I went through that. Man, I was healed of all the immune system problems. Anyway, so now we'll talk about a subluxation. What's that? That's when not just a vertebrae slips out of place, and this is what a lot of chiropractors do, is they may focus on specific vertebrae, but the truth is the curves become displaced. The whole spinal structure begins to distort. So it's not a subluxation, is not just a bone out of place, it's a whole curve that is distorted, and this has all come from some of the latest scientific research that medicine even knows. And we're going to get to medical studies here, which I'm going to quote this one here about sudden infant death. So many chiropractors even address one vertebrae without looking at the whole region, when the majority of cases, the whole spine is under stress. So if you have bones that are out of place, it's typically those are the stress places because the whole spine is out of place. So the way you fix it is fix the whole spine, right? Fix the curve. So check this out. As a patient, you should ask to review the whole spine, all the regions of the spine, and all the curves of the spine, because like this book is going to show you in the latest medical studies, the truth is curve affects the cord. It's much bigger than a bone out of place. It's a whole distorted structure because your whole spine works like one region. If you have one area out of place, it's meant probably because the whole area above there was distorted. Or if one area is out, it weakens the other areas of the spine. Now the whole spinal cord is under stress, and we're going to go through those studies. So let's go to the sudden infant death study. I put it in here, and I put it on this title here. So it's all these names of these guys. Heart rate changes in response to mechanical irritation in the high cervical spinal cord region in infants. Now that's from the, Forensic Science International. This is a medical study that's proving trauma during the birth process can not only lead to immune system function, but heart problems that can lead to sudden infant death. And what's the medicine? Well, we don't know. Just don't lay them on the stomach. Medicine knows. They know. They're not telling you, because when you know this, you're going to go right from the hospital, birthing center, wherever you go. You're going to go straight to the chiropractor. You're going to make sure their spine is in line because you know their immune system development is dependent on it. Their motor function development is dependent on it. Their learning ability is dependent on it. Their speech ability is dependent on it. Their normal development and biomechanical function of their whole body is dependent on it. So how important is that? Okay, we're getting into the juicy stuff of this book. We're doing this every Tuesday, 6 o'clock. Go to the Secrets of the Seven-Figure Lifestyle Practice. Ask to join. Let's go through this together. And please share this video with your patients, with the general public, because they need to know that, right? We're tired of the secrecy. It doesn't work anymore. We are creating a new world, a new healthcare, and better, healthier families. All right, love you guys. Peace.